Hello everyone, I am Dr. Sirisha Singh. I am a dermatologist and cosmetic dermatologist. We are going to do a brief chat on hirsutism. Hirsuts essentially put are women who have excessive hair. There are two types of hair follicle. There is vellus hair and there is terminal hair. Vellus hair are hair which are very fine in texture, very fine in appearance and really not visible very easily. Terminal hair typically are the hair which are seen on the scalp, in the eyebrow area. These hair follicles are thick, coarse and are visible even from a distance. Normally in a woman on the face there aren't many terminal hair follicles, but there are millions of vellus hair follicles. When these vellus hair follicles get converted to terminal hair, that is they produce thick, dark, coarse, black hair which is easily visible, then this condition is called hirsutism and the women who suffer with this are called hirsutes. Hirsutism can affect not only facial hair, it can also affect hair in the breast area, in the chest area or also in the abdomen. That is all those parts of the body which do not normally have terminal hair. Hirsutism as such is not a medical condition, it is a symptom of some other underlying problem. This is the most important factor which should be kept in mind while looking at women with hirsutism. Usually it denotes that these women who have excessive body or facial hair have either an excessive amount of androgens, which are the male hormones, or they simply have hair follicles which are very sensitive to the androgens in their body. Their body androgen levels, that is the male hormones in their body, may be completely normal, but they have hair follicles which are sensitive to the normal level of circulating androgens in their body. Hirsutism is very commonly seen nowadays in young girls with polycystic ovary disease. It can also be seen in those women who have an excess of prolactin, an excess of growth hormone, an excess of steroids in their body. It is also seen in women who are obese because fat acts as metabolically active tissue and converts the good hormones into bad hormones in the body. The treatment of hirsutism mainly revolves around finding out the cause of hirsutism, the commonest causes being obesity and polycystic ovary disease. So if you are a pubertal girl and you have hirsutism, the chances are that you have polycystic ovary disease. Treatment of hirsutism revolves around the cause of hirsutism. For example, if you have polycystic ovary disease, then this needs to be looked into and your lifestyle needs to be corrected. That is, you need to lose weight. You need to start exercising regularly and you need to start eating the right kinds of food which will not mess up your hormone levels. To deal with the excessive hair, there are several options available. You may consult your dermatologist who might prescribe you medications like spironolactone. Metformin is commonly used in young girls who have polycystic ovary disease and this helps to reduce the amount of facial hair in young girls with polycystic ovary disease. Several other tablets are also available to reduce the amount of hair, but these tablets need to be used only after the diagnosis has been ascertained. In some cases, the doctor may prescribe you creams which contain eflornithine. Eflornithine is a chemical agent which reduces the amount of facial hair by converting the growing hair into the sleeping phase. But the maximum license currently is for 6 months and it is not really licensed for long-term use. I personally restrict the use of eflornithine to women who have grey hair which does not respond to laser or to young girls who are travelling very extensively and need something for a short period of time when they are travelling because they do not have any access to services when they are travelling. Otherwise, the treatment of hirsutism depends upon it's a completely personal choice. One can go for any hair removal methods. You can go for waxing, you can go for threading, you can go for using an epilator, you can use depilatory creams, or you can choose to get laser hair reduction for permanent reduction of this unwanted hair. If you have any further queries on any of these conditions, feel free to contact me. My contact details are given in the description box below.